a pleasure to have you here, and on behalf of Jody, Lygia, and myself, warm welcome. And this is a hybrid meeting, so we have a few people online, which is quite interesting, I hope, and a nice one. The presentation will last about 30 to 40 minutes. We will have Q&A at the end. For the people online, if you have any question, please just type it on the chat. Jody will help us just turning around, and at the end, we will just switch between in-person and online questions. The presentation will be recorded, so in case you cannot stay for the whole thing, we will share it after on the website. And well, I am going to be chaired today as well, because Zoe Colombet, a lecturer at the University of Liverpool in the NCD Prevention and Food Policy Group. And well, we both work in ultra-processed food, and we're trying to do some good science around this concept and trying to understand how it works for the people that are most affected. She works on adults, I work more on the youth side, and yeah, trying to find avenues for collaboration and trying to understand this concept, and with the final aim to enhance public health policies. So over to you, Zoe, and it's a pleasure to have you.
Thank you. Yeah, good morning, everyone. So it's a great pleasure to be here today. Yana do a fantastic intro, so I will get the intro myself. Just before starting, I have no conflict of interest on this presentation. And even if I'm working on UPF, I don't have all the answer about it. And I'm here mostly about stating what I understand about it. It's my point of view, no one else's point of view, and I will be happy to discuss that. Not good or bad answer for that. So yeah, hope my presentation will help you to see how we need to clarify the UPF concept and classification to enhance public health policy. So I'm happy to be there. I was in France this weekend, and I was a bit scared not to be here today because we are famous for strikes right now and for our food policies. And in the plane yesterday, finishing the presentation, I was thinking about that the French are able to fight for their food culture in the future. So I will try today to explain how and why we should fight for food culture. Anyway, I will quickly make an overview of that. We need to be interested in food policy and our solution, because for 70% of all deaths worldwide are caused to non-communicable disease. A huge part of this can be avoided with health, can be due to health. If we are focusing a bit on obesity, as you may know, more than 1 adult in 4 is being obese in UK right now, so it's huge. And alimentation and diets is part of the causes of obesity. So why UPF? So I'm talking about UPF, it's short for ultra-processed foods. So they are beginning to be recognized as an emerging health risk. So evidence is growing, showing that greater consumption of ultra-processed foods is associated with higher risk of adverse health outcomes, including obesity and non-communicable disease. So now we have more than 70 prospective studies that show association between high consumption of ultra-processed food and health. So I have mapped here all the meta-analyses I'm aware of. So I can give you the references later on. But before, I want to do a bit overview of what is ultra-processed. Who are the ultra-processed? So the first thing is, when we are talking about ultra-processed food, it's a word that has been not designed, but almost designed by the NOVA classification, which is one of the classification about processed foods developed by Carlos Montero and the Sao Paulo team. So we will talk about that later. But otherwise, we are talking about highly processed products or highly processed foods. So I will talk about UPF because it's easier and everyone is knowing it. First, I want to state that you have a huge differences between processed products and ultra-processed products. So the processing, we are using processing in food and diets. since a long time. It's not new. We are using processes to preserve food, but also to protecting our health from development of microorganisms or something. So everything that has been processed, even industrially, is not ultra-processed foods. Also, all industrial products you can buy on the supermarket, are not UPF also. You can find pretty healthy products that are not UPF. Even if we don't have any consensus definition of UPF, and I found that a bit problematic, we in the scientific community more or less all agree that it's formulation of ingredients derived from foods with additive and mostly cosmetic additive, but are not here to protect our health or the products, but mostly to disguise the products or try to map or to imitate the taste of something else. These products tend to be highly palatable, convenient, often ready to consume. They can stay for a long time on shelf. Sorry, it's hard for me this one. And they are mostly affordable to people. They are cheap. And they are often marketed in appealing way. You want to have them. It's appealing you. Not all, but in average, most of the UPF have high consumption of fats, sugar, salt. They are energy dense, and they are lack of micronutrients. And a growing literature is also showing that the content of UPF have been associated with poor dietary quality. It's not all, but in average it is. So we have a problem here, but no worries. So different classifications have been developed by researchers to try to identify in the consumption and the processes this UPF. So here you have multiple, it's not all, but a different classification system that exists. And today we will talk only about the NOVA classification developed by the Sao Paulo teams, because it's the most used actually in the literature, is the one that is in debate right now. So we will talk about that. So what is the NOVA classification? It's a classification on every food and drink according to the degree of processing. You have 4 groups, from unprocessed or minimally processed to ultra-processed foods and drinks. So briefly, when you are looking at the definition given by a Montero team, this is the kind of thing you have. So you will have a definition explaining why it's here, what products are here, and you have some examples. So here in this group, you have the unprocessed, which is basically all fruits or animal parts that are not processed. And you have some minimally processed, which are processed like remove a little pulp, powdering, freezing, which is mostly not adding nothing on it, but preserve food or protect your health. Then you have the second group about processed culinary ingredients, which is basically processed product obtained and that you will add to group 1 to preserve the food or enhance the taste or your health. Then you have the processed foods, which is made mostly group 1 plus group 2. And then you have the ultra-processed food and drink products. So you have a huge definition here, and you have some example of what is in this group. So mostly convenient food, ready to eat, highly palatable products, etc. So now you know how it works a bit for the NOVA classification. You have seen what are the examples we have and all the information we have with the NOVA classification. This classification has been developed for purchase data. So let's do again. If I'm saying what group should we put this? You are in a supermarket, you are saying this. It's NOVA 1, 2, 3, or 4. It's octopus ball. I don't even know what it is. So you can pre-cook it, microwave for 2 or 3 minutes. So 3. Unfortunately, it's mostly a 4 because you have a lot of things inside that you cannot have on your kitchen to cook it. Okay, but if I'm saying this one, which is a soup, vegetable soup. Yeah, 3, yeah, this time, yes. Nothing you cannot have in your kitchen to cook this for yourself. So it's ready to consume too, but you have not things adds to, I don't know what is this purpose, but anyway. And then this one, this wonderful yogurt. Yeah, of course, it's a 4. You have a lot of things that is not even related to yogurt at the beginning with. But the problem is I'm not working, or mostly I'm working on consumption data. So I have some information. So if I'm saying today I ate a strawberry ice lolly, I ate something which is 1, 2, 3, or 4. It depends. Yeah, if I'm eating that, of course I will have something which is mostly 4. But if I'm doing this myself with only strawberry, sugar, water, and lemon juice, then I'm mostly a 3. So according to the level of information I have in my consumption data, it can change my classification and how I'm classifying my foods. So again, let's do it together. So I'm on NDMS. It's the meal of someone at 1 that declare everything here. This is the food name I had. So I will not go through every one of it. But if I'm said I have squid balls, we will say 1, 2, 3, or 4. 1. Yes, it's surely 1. We don't know about added salt or something, but we will say 1. Okay, cabbage, frozen balls. Yeah, 1. So we can go like that. But mostly we see here, I will say, oh, these guys eating mostly 1 or 2. But if I'm looking at not the food name, but the food group description, then it's getting a bit complicated. All the selfish, including omelet dishes. So here I'm mostly on something that have been cooked. So I will say 1, maybe 3, if we have some salt, if we have some sugar on it, I don't really know. And then I'm starting having some doubts. But I can relate on this to make a decision, why not? But then NDNS is quite well done. And then we have a group, a column, which is recipe. And then I realized that everyone here is in fact part of one and only recipe, which is manufacturer selfish products, which is a 4. So according to the level of information I'm looking at on the same databases, I can have different estimation. So, and at the end, I even have the name of the foods in the NDNS base. So and so that this is the project that have been recorded by the participants. So we can do that for other things, but basically that can be pretty tricky. So this is why a lot of debates exist on the NOVA classification. So when you are working on consumption data, depending on the level of information you have, you will need to make some decision or assumption. It's not bad, it's not good, it's what it is. It depends on your information. We have not standardized way of doing the classification. So it also depends on your own interpretation of the information and example you have on the Montero paper. And you have some paper that says that this classification is not functional enough, that leads to a low overall consistency among evaluator. And you have also a good paper, an amazing paper that tries to see how consumer conceptualize the UPF. And you can see that some projects are well mapped in the mind of consumer, but some products are not. So you start to see some limitation of this classification as every classification. But with the NDNS data, we are sure one thing is my team classified used the NOVA classification in NDNS. And Yana here did the same on her own. And then we met and said, oh, let's compare. And we're ending to a 87% agreements, which is not bad at all. It's pretty amazing because we have a lot of information in NDNS. And then we discussed a bit about our differences. And the main differences was she was the good guy, I was the bad guy. She was pretty like, oh, but let's do conservative approach. They should cook. I'm sure they have cooked this lasagna. And I was like, no, I'm sure they buy it. So the differences was pretty much about that. But we finally agreed. I'm agreeing with Janaina, we should be more conservative, and now we have a 97% agreement after discussion. So the NDNS data is pretty well constructed to apply another classification. So just to say here, I did a low and high estimation. So when I added out about 3 or 4, as I show you, I was doing putting on 3 for the low, putting on 4 for the high. And you can see that on the NDNS data, the differences are not that high. But I did the same thing for my thesis, my PhD, on the French West Indies. Totally other way of recording foods, not the same level of information about recipe, not the same level of information about brands. It was very not recorded as NDNS. And then you can see that my decision had a huge impact of the percentage I can observe in my data sets. It was doubling the intake of UPF. So depending on the information we have, we should be careful about how we make decision and maybe add this in our limitation, or at least make our decision very clear in our paper for the other people to see where the gap can be. But that is very a limit. Like, even if we are all making decision and all choosing maybe a different classification, more than 100 of paper now are saying the same consistent signal. Everyone saying that a higher consumption of UPF will lead to higher health risks, even if the design are different and our use of NOVA is different. So it seems pretty reliable after all, from my point of view. And it's anecdotic, but on the cross-sectional analysis we did with Janaina in UK and me for my French West Indian PhD, even if I was using the low or the high hypothesis of NOVA classification, I mapped the same socioeconomic association. So after all, I was seeing quite the same thing. For me, that means that maybe we need to change a bit of the way we are recording information in our data basis. So as I see with the NDNS, a better data recording leads to limit this bias and make it easier to classify the NOVA and identify ultra-processed foods. So maybe we can only add information about brand and recipe. It will make our work very easier to identify UPF after all. And maybe we can also imagine having some information about all the additives in the product depending on the brands and the recipe in the data composition table we are using anyway. So it's an idea. But as Monterey is saying itself, we need to debate anyway about this classification. It's not the perfect classification, but at least it's enhanced a new area of research and it leads to debate and exchange on this area. So anyway, let's debate about this, whatever you think about this classification. I'm still using it because it's the best I can use right now for my work. But I'm talking a lot about ultra-processed food, who they are, you know it now, but why? Why are we insisting in that? So I said a bit in the introduction, we want to study it because it seems to be linked to health, because we are also seeing that UPF are highly associated with poorer dietary quality, but a lot of studies now showing that even if UPF and nutritional quality are correlated, that seems to be very distant and complementary dimension of the diet. So we need to take into account the nutritional quality of the diet and UPF, but it seems that we also need to take into account of this UPF. The mechanism beyond that, the main way of thinking right now is that it's linked to health, not only with nutrition and quality, but also through ultra processing, which will be on itself harmful to health. It will be through some processing. It can be through the additive we are putting on the products. It can also be through the packaging, because we are leaving the foods a long time in contact, for example, of plastic. We can have exchange with the continents. And when we eat our food in plastics also, we can have some exchange. And maybe this is part of the explanation between the relationship between UPF and health. Some also are working right now on the change that the UPF put on our microbia and other things. But overall, we need to better understand why it's linked, how it's linked. And this is the work of amazing people that are doing that right now. It's not my job anyway. Yeah, I'm supervising a student, but it's a part of the job and very interesting. I hope I can have results soon. But even if the research on the impact of UPF and the underlying mechanisms is still needed, it's a new area, the current state of knowledge still calls for implementation of initial preventing public health actions. So based on the available evidence, some countries have made dietary recommendations using this NOVA classification. So this is all the country I'm aware of. Basically, it started almost 10 years ago. The most recent one is pretty young. And all the recommendation we can map, translate in English here, is always like, you should avoid consume UPF, you should decrease your UPF index, and instead choose minimally or less processed products. So from the public health policies perspective, it's quite hard to understand. You can, but it's quite hard. And even the French go way beyond that and said, we will reduce by 20% our UPF consumption in 3 years. We still don't, but anyway, they were pretty optimistic about that. But we can say the example of the boy, which is not, I found this pretty interesting. So they give a book which try to explain how you can replace these ultra-processed products by less processed products. So it can give some example to the population of how they can reduce this, but it's not perfect anyway. Also, we have more and more association that's also take into account this concept of UPF on their recommendation, so it's growing. So we need to take the train as public health researcher, nutrition researcher, and look at that. Even if some people argue that it's too soon, but the concept of UPF is not mature enough and too hard to use in a policy tool that is rushed. Some also argue that food category-based recommendation, as it is for UPF, are useless when it comes to choosing between two foods that has the same selling name, but different ingredients and nutrient composition. So I can understand that. And maybe we should also take into account some extra score with the UPF. Can be understand. But for me, the main thing is that this classification, useful, perfectable, but useful, also identify a group, UPF, that is maybe too broad to be used in the public health area. So this is how we are working with, it's our work with Yanaina and Rebecca, actually. We are trying to identify some different dietary patterns among the intake of UPF. So identifying some group of foods, the diet quality of this group, but also the characteristic, individual characteristics linked to this dietary intakes, and hopefully it will help the public health policy to better target UPF. So, from my point of view and our point of view, the UPF public health policy should focus not only on UPF itself, but mostly on why we are eating UPF and why people are eating UPF. We should be conscious that UPF is not always because we want to have UPF. It's mostly because it's cheap. Because in our society, we have less and less time to cook. We are not willing to cook that much. I'm not willing to spend 1 hour a day on cooking something when I'm tired of my day or something like that. So sometimes I'm eating UPF because it's easy, it's cheap, it's comfort food also sometimes. So we are not perfect. So we should also take that into account in the public health policy. But also the marketing, pretty aggressive. You are going on the street, you are seeing a beautiful ads for some cookies, or I don't know, then you want just a cookie. It's marketing, it's well designed for that. And I'm not inventing anything. You have a beautiful paper right by Jean here about the public health responses to ultra-processed foods and drinks, but offer a lot of possibility about how we should handle that on the public health policy perspective. So some idea mixing what is stated here and what my work is on. We should act on the product, but not only from the nutrient reformulation perspective, but mostly on the global reformulation. As I show, not only the nutrition quality can explain the link between UPF and health. So, okay, we can reformulate the sugar contents, but it will not explain all the relationships. So we need also to take into account the UPF and sound, and maybe just do less processed products or review the processed that are dangerous or the additive that are dangerous and get rid of it in the things. But we should also act on the consumer. We can ban ads like the watershed is planning to do. We can tax UPF, as this has been done with the SSB, sweet sugar beverage or something. We can also ban promotion of UPF in the streets. So I was on the subway and I was seeing a lot of ads, only ads for books and movies. And I was like, oh, amazing, I want to read a book, I want to go to the movies. And then getting outside, I was seeing an hamburger, I said, oh, now I want hamburger. So maybe if we are reshaping our environments and banning some ads for UPF, it can also help. We can also, of course, implement cooking or purchasing classes. And we can also act on the construction of environment, like banning promotion from supermarkets, increasing price of UPF, decreasing price of minimally processed, helping some businesses that wants to sell some non-UPF but ready-to-eat things without UPF, like, you know, having a nice meal cooked lasagna by a lady on the streets rather than going to McDonald's or something like that, you know, and eat UPF. So some thought about that. And often people, when I'm talking about UPF, said, yeah, we should do the same thing, but the cigarettes did. And then I was imagining a world where instead of that, we will see that in supermarket. It was like, maybe it's too harsh. So maybe only black box with only the name should be fine, but maybe not. But scary thing from diabetes or losing teeth because of sugar, you know, can be scary. But it can be something we can learn from the policy, the tobacco policies. But I'm not sure this can be done, and it will be a nightmare. We will stigmatize some people, and it's not something we want to do. So, okay, we need to learn from other policy. Let's stop mocking things, but let's be realistic. Let's think about how we are eating things, and then we can understand how we should do policies. We can also, add some for healthy products. A lot of people are doing this, but give you, like, you are going on the street and you want a banana instead of wanting a burger or something. So we can think about that. So now, a bit more about my work with Janaina. So to help policy sector, we are mapping the inequality. We are trying to help targeting the people that are the more at risk with the UPF. We are also doing a job with a PhD student using spatial microsimulation, trying to see local differences in UPF consumption that will lead hopefully to some experimentation about modeling some scenario, some food policy scenario. So we have some policy targeting UPF, not that much, but it will come. We need to do experimentation. We need to do tests if we are not testing, making only hypotheses, we will not work. And this is how we are pretty much complementary with Yanaina. We can do experimentation. Then my skills and my team, I will talk about that just after that. We can do some scenario modeling. So taking some lab results and expand that to an whole population, taking into account social inequality, differences, etc. And then we can evaluate it. What will be the impact of health? What will be the cost for the society for public health policy implementation? What will be the gain for the health system by reducing mortality, by reducing diabetes, mortality, obesity, things like that. So this is the big project we have in collaboration with your team, like having both our knowledge. So this is my team, actually the NCD Prevention and Food Policy Research Group. So we are doing a lot of work around the world, working on the food policy space. So not only UPF, we are working about evaluating a lot of food policy. The more recent one I'm working on is evaluating the new menu calorie labeling policy in the UK. What is the impact of the current implementation? So the current implementation only in the large businesses, 17% of all food sector in UK is not very effective. So with modeling, we are showing that we need to increase and expand this policy to all food sector, taking into account the costs, but will be for the small businesses anyway. So we are also working on evaluating the impact through policy scenario of reducing UPF. These two papers made by my team, partnership with my team, are very amazing. We can see that if we are improving nutrient intake on UPF, then you can prevent death, diabetes, and things. But my concern that we are modeling impact through the intake of salt, saturated fat, trans fat, but not UPF itself. And the point of this presentation was, I hope you understand that I believe that it's not the only way of UPF impacting health. So we need to be more broad, like they did. So it's a paper I reviewed, and they used relative risk from UPF consumption on all-cause mortality. So this is the kind of work we need to do for UK, the things we need to face. And I don't want just to say, you need to reduce by 10% your UPF intakes. For me, it doesn't make many sense as a person that eats every day UPF. I don't know what that means, reducing by 10% my UPF. So I want to use my skill as a modeler and my team and my collaboration with Yanaina to try to find policies at work, do some modeling scenarios, and try to sell that to policymakers to have a real impact on this. So even if we are not striking again yet for our health, I'm continue to strike for public health, and I try to, as a researcher, do what I can, and I'm happy to launch a debate about my view about that, discuss that, because it's how we increase research, public health policy, and make things change. So thank you for your attention, and I will be pleased to answer any of your questions.